It's 11:40 at night and your dog won't stop shaking his head. Not the quick, happy shake after a bath. This is different. Harder. Almost violent. And every few seconds he stops to paw at the side of his face, like he's trying to claw something out from the inside. You crouch down, lift the ear flap, and the smell hits you before anything else does. Sour. Warm. Almost yeasty. Like bread left out too long. The skin inside looks angry and red. And your first instinct, the one almost every owner has in this exact moment, is to grab a cotton swab and go digging for whatever's in there. What if I told you that instinct, that reasonable, caring, I just want to help him instinct, is the single most common way owners turn a minor ear problem into a genuine medical emergency? Hi everyone, I'm Dr. Scott Reynolds, your neighborhood veterinarian, and ear problems are one of the most common reasons dogs end up in my exam room. Not because they're rare or mysterious, but because by the time most owners bring their dog in, days or weeks of well-meaning home mistakes have made things dramatically worse. Today I want to change that. We're going to walk through exactly why dogs' ears are built the way they are, how to actually check them properly at home in about 2 minutes a week, the one habit I need you to stop doing tonight, the safe technique that replaces it, a tiered set of real home care options depending on how mild or advanced things are, and, because I never want you guessing on something this important, the exact red flags that mean it's time to put the home remedies down and get to a vet. And if you find this kind of practical, no-nonsense pet health information useful, consider subscribing, because this channel is built entirely around keeping you out of my emergency slot at 11 p.m. on a Tuesday. Let's start with the biology, because understanding the shape of your dog's ear canal explains almost everything else in this video. Unlike your ear canal, which runs in a short, fairly straight line to the eardrum, a dog's ear canal is L-shaped. It drops vertically down from the opening you can see, then makes a sharp turn and runs horizontally inward before it finally reaches the eardrum. That bend means the ear canal is essentially a warm, dark, humid pocket with poor airflow. I like to describe it as a biological greenhouse. Body heat keeps the temperature stable, the vertical canal traps moisture from baths, swimming, or humid weather, and very little air actually circulates down at the bottom of that bend. Yeast and bacteria already live on healthy ear skin in small, harmless numbers as part of the normal microbial balance, but give them a warm, moist, low-oxygen environment, and they multiply far past their normal levels. That overgrowth is what causes the redness, the odor, and the itch you're seeing. It's rarely about something being wrong with your dog's ears from birth. It's usually this greenhouse effect tipping a normal balance into an overgrowth problem, sometimes triggered by allergies, sometimes by moisture, sometimes by underlying skin conditions. So Chapter 2, how do you actually check for this at home, safely, in about 2 minutes? Here's the routine I want you doing weekly. Gently lift the ear flap and look at the visible part of the canal opening. You're checking for color, for any discharge, and for swelling. Healthy ear skin is a pale pink, similar to the inside of your lip. Then do a sniff test. Healthy ears have little to no smell, maybe a faint, neutral warmth to them. A sour, yeasty smell or a sharper, more unpleasant odor is your first sign something's off. Finally, gently press and massage the base of the ear flap, right where it meets the head, and listen. A healthy ear often makes a soft, squelchy sound from normal wax and fluid moving around. But your dog shouldn't flinch, pull away, or show any sign of pain when you do this. And here's a myth I want to clear up while we're on the subject. A lot of owners see dark, coffee ground-looking debris and immediately assume ear mites. Mites are actually a fairly uncommon cause of ear problems in adult dogs, especially indoor pets. They're far more common in puppies, dogs with lots of outdoor or shelter exposure, or dogs in close contact with an infested animal. In most adult dogs, that dark debris is much more likely to be a buildup of wax combined with yeast or bacterial overgrowth, not mites. Either way, the visual similarity means you shouldn't self-diagnose mites from looks alone. But it's worth knowing the odds before you panic. Now, Chapter 3, the most important part of this entire video, the dangerous mistake. When owners see debris, discharge, or smell that odor, the instinct is almost universal. Grab a cotton swab and go digging. I need you to stop doing this tonight. Remember that L-shaped canal we just talked about? A cotton swab is straight, and it's being pushed into a canal that bends. What actually happens is the swab doesn't remove debris. It pushes it deeper, packing wax and discharge down past the bend and directly against the eardrum, where it's now impossible for you to see, reach, or clean. In the worst cases, blind probing with a swab can injure the delicate lining of the canal, or, if pushed too far or too forcefully, damage or even rupture the eardrum itself, which can lead to pain, hearing loss, or a much more complicated infection involving the middle ear. Never insert a cotton swab or any solid object blindly into your dog's ear canal. The anatomy simply isn't built for it, and you cannot see what's happening at the bend from the outside. So what do you do instead? This is Chapter 4, the safe alternative, and the mechanism here is actually elegant once you understand it. Instead of trying to physically dig debris out, you flood the canal with a liquid ear cleaner designed for dogs, then let the dog's own head shake do the work. Squeeze a generous amount of a veterinary ear cleaning solution into the canal, not a swab, a liquid, then gently massage the base of the ear for about 20 to 30 seconds. You'll hear that squelching sound as the liquid breaks up wax and debris and works it loose from the walls of that L-shaped canal, including the parts you could never reach with a swab. Then step back and let your dog shake their head. This is a genuinely useful reflex, not something to suppress, because the shaking flings the loosened debris and excess liquid up and out of the vertical canal. Finally, take a cotton ball or soft gauze, never a swab, and simply wipe away whatever debris is now visible at the opening of the ear. You're cleaning what the shake brought up to you, not chasing anything deeper. Let's move into Chapter 5, the tiered remedies, because how you handle this really does depend on how mild or advanced the situation is. Tier 1 is routine weekly maintenance for a normal, healthy dog, especially one with floppy ears or one that swims often. Use a vet-formulated ceruminolytic ear cleaner, the liquid and shake method I just described, once a week, and this alone prevents the vast majority of buildup-related problems before they start. Tier 2 is for dogs prone to moisture-related irritation, like frequent swimmers. After swimming or bathing, a drying rinse made of equal parts white vinegar and water, or a commercial drying ear solution, can help evaporate trapped moisture and mildly discourage yeast overgrowth by shifting the pH. Apply a small amount, massage briefly, then let your dog shake it out. The safety caveat here is non-negotiable. Never use a vinegar rinse, or any acidic solution, on an ear that has visible redness, swelling, or broken or irritated skin, because the acidity will sting significantly and can actually damage already compromised tissue. Tier 3 is for dogs with recurring, mild irritation that keeps coming back even with regular cleaning. This is often a sign of an underlying allergy, whether environmental or food-related, since allergic skin inflammation is one of the most common root causes of chronic ear issues, and in these cases, working with your vet on identifying and managing the allergy trigger tends to reduce ear flare-ups far more effectively than ear cleaning alone. Tier 4 is for a dog with a confirmed diagnosed infection that keeps relapsing. At this point, over-the-counter cleaning is a supportive habit, not a treatment, and your dog genuinely needs a prescription-strength medicated eardrop from your vet, matched to whether the underlying organism is yeast, bacteria, or both. Now here's my favorite trick, and it's a genuinely useful bit of insider knowledge. Chapter 6. Before you even reach for a cleaner, use the flashlight on your phone. Hold it at an angle just outside the opening of the ear canal, not inside it, and look at the color and texture of the skin, as far down as you can see. This costs nothing, takes 10 seconds, and lets you catch early redness, swelling, or discharge changes weeks before they'd be obvious to the naked eye in a quick glance. It's the same basic principle vets use with an otoscope, just without the magnification or the ability to see past the bend. Pair that with the weekly base of the ear massage test, and you've got a genuinely solid early detection habit. This brings us to Chapter 7, and I want to be really direct with you here, because this is the part of the video that matters most. Home care has real limits, and there are specific signs that mean you need to stop everything you're doing and get to a vet. Not tomorrow, not if it doesn't get better, but promptly. If your dog's head is tilting to one side and staying that way, if they're stumbling, circling, or showing any loss of balance, that can indicate the infection has moved into the middle or inner ear, which affects balance structures a home cleaner cannot reach or treat. If there's thick discharge that's yellow, green, or bloody, rather than the lighter brown or waxy debris we talked about earlier, that points to a more established bacterial infection needing prescription treatment. If your dog cries out, snaps, or won't let you touch the ear at all, that level of pain means there's likely significant inflammation or even a developing ulceration that needs a proper exam. If the ear canal looks swollen nearly shut, or you notice a visible lump forming on the ear flap itself, that swelling can be a sign of a hematoma, or severe inflammation, requiring drainage or medical management. And if the odor is extremely strong or foul despite cleaning, or the problem keeps coming back within days of treating it, That's your sign of a resistant or deep-seated infection. The reason these situations need a vet and not more home cleaning is simple. Only a vet has an otoscope that can actually see past that bend to the eardrum. Only a vet can take a sample under the microscope to identify exactly what organism is involved. And only a vet can prescribe the specific antibiotic or antifungal drops, or in some cases the sedation needed, to properly clean and treat an ear too painful or swollen for a home cleaning to safely reach. So let's bring this all together. Your dog's ear canal is built with a bend that makes it easy to disturb and hard to see into, which is exactly why cotton swabs backfire and liquid and shake cleaning works. A 2-minute weekly check, look, sniff, gentle massage, quick flashlight glance, catches problems early, long before they become the 11 p.m. emergency we opened with tonight. Tiered home care, from routine cleaning to drying rinses to allergy management, handles the vast majority of ear issues safely, as long as you respect the caveats around broken skin and acidic solutions. And knowing exactly when to stop and call your vet isn't a failure on your part, it's the single most responsible thing a pet owner can do, because it means you're protecting your dog's hearing and comfort instead of guessing. I want to hear from you in the comments. When you did the sniff test tonight, was the smell faint and neutral, or did it catch you off guard? I genuinely read every single comment, so tell me what you found. And if you're not sure whether what you're seeing counts as normal or a red flag, describe it, and I'll do my best to help point you in the right direction. If this video helped you catch something early, or just made you feel a little more confident checking your dog's ears tonight, do me a favor and hit like and subscribe. It genuinely helps this information reach other worried pet owners who are exactly where you were 20 minutes ago. I'm Dr. Scott Reynolds. Stay safe, and I'll see you in the next one.